I want to send a special shout out to Julia Shellmeyer and the 4x100 team at the University of Oregon, coming in 6th in the country. Big shout out to them. Another shout out to my nephew, Nori Cherry, who's graduating from Beaverton High School and will be attending the University of Oregon next year. Welcome back to the show, ladies and gentlemen, boys and girls, heroes and villains. I'm your host, Deshaun Fauntleroy. I know your time is precious, so we're going to get right into today's show. In today's show, the big idea is Dr. David Geier. This gentleman has been featured on or interviewed by USA Today, the New York Times, Fox Sports, ESPN, CBS Sports, Women's Health, and Men's Journal, just to name a few. I mean, the list is literally too long to mention. I'll let him fill in some of the blanks. But more importantly, I have an orthopedic surgeon and sports medicine specialist joining us on the show today. What are we going to talk about? How and why playing one sport year-round can do more harm to your kids than it helps them. Why we should focus more on fun and less on winning and statistics at a young age. Steps parents and coaches can take to prevent ACL and other injuries in young athletes. What parents should know about concussions in football and other sports. Without further ado, I want to welcome Dr. David Geier to the show. Welcome to the show, Dr. Geier. Tell us a little bit about you.
Oh, thanks, Deshaun. That was really a really nice interview, way nicer than I deserve. Yeah, I'm an orthopedic surgeon in Charleston, South Carolina. I specialize in sports medicine, so I have two certifications, board certifications, one in orthopedic surgery and one in sports medicine. And I take care of athletes from the pro level down to the kids that play youth sports and all of the adults in between, that just like to exercise, and work out and play rec league sports themselves. I try to help people stay active and perform their best.
I really appreciate you reaching out to me, man. I have another business, Pro Force Athletics, where I work with middle school, high school, and college athletes. From time to time throughout the year, I'll work with a handful of semi-pro athletes in terms of arena football athletes, Canadian football athletes, and minor league baseball athletes. But where I'm located at, the storefront is a physical therapy clinic. So every day I see physical therapists, licensed massage therapists, chiropractors, and acupuncturists. So when you reached out to me, it was only fitting that I would have you on. I know you're a busy guy. I realize that this call could end at any time in case you're rushed into a trauma to help somebody. So again, man, I appreciate you coming on. I want to get right into it. And as they say in Texas, let's cut through the hay and get right to the horses.
Sounds good.
So let's talk about how and why playing one sport year-round can do more harm to kids than it helps them.
Yeah, I think that this is something that's really changed since at least the days when I played sports. When I played, we played different sports every season. I played, soccer in the fall and basketball in the winter, baseball in the spring, and swimming in the summer. And I enjoyed every single one of those. And there was really no pressure on us as young kids, at least, to pick one sport. I ultimately chose travel soccer, but that was a choice I made when I got older. Now these kids are really being pressured by coaches, by parents to pick one sport at a very young age, sometimes 7 and 8 years old, and play it year round. And that really takes away any chance of a long period of rest during the season. And the problem is those kids' bodies aren't really built to withstand that repetitive stress for so long. They don't have the muscle strength to take that pressure from whatever the movement in that sport is or the impact in that sport is. They don't have the muscle strength to take that stress off the bones and the tendons and the ligaments of a joint. So those little microscopic stresses add up over time. It doesn't matter if it's an upper extremity sport like baseball or tennis or lower body like football or basketball or soccer. that wear and tear builds up over time, and you do that long enough and your body's going to break down. It'll be a stress fracture, or it'll be some sort of tendonitis, or even a ligament injury that can lead these kids to injuries that, often are months out of sports, or sometimes even surgery, and they're completely preventable.
I grew up in Danville, Illinois, and I grew up playing organized tackle football. When that wasn't in, we were playing organized basketball. When that wasn't in, we were playing organized baseball. So sometimes even when baseball season wasn't in, or in the middle of the day in the summer, we would be up at Lincoln Park and on the tennis courts playing stick ball or baseball with the tennis balls, because there was a tennis club on the other side of the park. But it was big. We were always active. And if we wasn't doing baseball, football, or basketball, we were wrestling, slap boxing, or getting into fights in the backyard and then getting reprimanded for that. But when I look back on my youth, those are some of the things that prepared me as an athlete, and even exploring like the Kung Fu, because we grew up watching Bruce Lee movies, and then we would go out and play karate in the backyard. That I have a respect for MMA to this day because of those things. And then doing backs off the mattress in the backyard, using that as a trampoline. So everything that you're talking about in terms of being a multi-sport athlete coming up, it makes perfect sense.
Yeah, I think, I wrote a book that came out not all that long ago, and I interviewed for it Brandy Chastain, and we talked about ACL injuries. But as we were finishing the conversation, I just ran it by her. I was like, hey, because I knew she still coaches youth soccer and coaches as an assistant at Santa Clara. Brandy was on the 99 U.S. women's national team that won the World Cup. And I asked her, how do you feel about kids today playing just soccer, playing just one sport year round? And she told me something really interesting. She said that none of the members of that 99 U.S. women's national team only played soccer growing up. And Brandy played, if I remember correctly, she played basketball, baseball in addition to soccer. And she said that those other sports taught her so many movements and different skills, balance, and a lot of different ways to interact with her teammates that she never would have gotten if she only played soccer. And she really felt like it made her a better athlete. She used the analogy of it'd be like only studying math or only studying English in school. It doesn't make you a well-rounded, smart student. You need to study everything, and it's no different in youth sports.
What's interesting, Dr. Geier, is I've worked with an athlete over in the Vancouver, Washington area, which is very close to Portland. It's just a bridge away. And this gentleman, his parents, they probably still have about 5 or 6 training sessions left with me to this day that goes back to 2013. And the reason why I say that, this gentleman is, I want to say probably, I'm not going to name any names, but in a high level and well-known soccer organization. So he plays club soccer. He's on the select soccer teams. And then you also have like the season, the high school season. And to this day, I want to say he's close to graduating, probably graduating this week or maybe even today. Oregon State told him that he wasn't fast enough, that he needs to work on his speed. But what I found is that the pressure to play on the select team or the club team is so significant that they really don't allow him time to train because they're busy playing games. So if you're telling me as a soccer athlete, I need to get faster, where do I have time? And do I succumb? Like, they have the pressure to be at the practices and to play the game. So what are they going to do? They're going to sacrifice the strength and the sprint training to go practice because that's what they have to do.
Yeah, I think that's an interesting point. And obviously I'm not a coach, so I probably can't speak to this as well as the coaches, but just from a doctor's side, I see it, that is another shift in addition to just playing one sport that we're seeing, is that it's the amount of time that the kids spend in practicing game situations or actually playing games as opposed to the time spent developing skills. You mentioned speed. That would absolutely be true. But spent doing, strength training, time spent doing certain techniques and coaching patterns and various things. The focus is more on the final product, playing games, and much less on building the fundamentals, especially at a young age.
With this particular athlete, what I found is that he's not the most genetically gifted kid on the field. The time that I saw him play, there was actually another kid that was probably, like at this time they were like 5'8", 5'9", 5'10". But this one particular kid, he was stout. You could see the muscular vascularity on him. And the kid that I work with, not going to mention his name, you could physically see that he wasn't there. So if you're not genetically gifted, how do you make up for things that you don't already have like right now? And as you know, in America, we look for right now versus looking 4, 5, 6, or 7 years down the road. And that's one of his shortcomings due to the pressure of playing club and select soccer.
Yeah, I think it's that right now mentality pervades youth sports. I mean, I think it's the coaches that will basically overuse certain kids, the gifted kids. In the case of youth baseball, they overuse the 1 or 2 good pitchers and at the expense of those kids' health and not letting other kids play. It's this desire to make kids specialize in one sport. It's a desire to keep teams together year round in different leagues so they get used to playing with each other, and it's hard for other kids to make those teams. There's a lot of issues with this right now phenomenon. And let's be fair, I mean, kids don't earn college scholarships or pro contracts at 8, 9, or 10 years old. They just don't. That's when they should be learning skills and learning techniques and learning teamwork and everything else. And if they stay healthy, they stay interested and don't burn out, then as they hit the high school ages, then you can really focus on getting to the next level.
You've heard it before, parents, we're not going to beat a dead horse, but if you're a parent or the coach of an athlete, parent of a student athlete, and you're listening to this, allow your children to play multiple sports. Allow your children to do some strength training. Allow your children to do some rehab training. Allow them to do some prehab training. We're going to get to that. Allow them to do some strength training with the appropriate people or personnel. Now, I want to transition, Dr. Geier. On the bullet point list of our discussion is why we should focus more on fun and less on winning and statistics at a young age. Let's discuss that.
Yeah, I mean, I think that it sort of gets back into this idea of pressure on kids. One of the things that I see a lot are injuries related to being pushed too hard and to do too much. And that can be a focus on winning at all costs. So these kids constantly hear from their parents and hear from the coaches, even if they're 7, 8, 9, 10 years old, how important winning is, how important strikeouts are in the case of youth baseball or goal scoring in soccer or whatever the sport. And so they don't want to let their team down. They don't want to let their parents down. They don't want to let their coaches down. So then it might manifest in that, well, they start to hurt, but they don't tell their coaches or they don't tell their parents, and they push through pain, significantly increasing their chance of getting hurt. Or that pressure starts to build up. You give that long enough, it sort of festers, so to speak. We know that 70% of kids drop out of sports by age 13. And one of the biggest reasons for that is burnout from sports due to pressure from parents and coaches. And so we've really got to get this mindset of it's all about winning and it's all about statistics at that age group. We've really got to get that out of youth sports and really make it more about fun, learning fundamentals, learning techniques so that they, develop properly, they enjoy it, and hopefully stick around in sports once they hit the high school ages.
That's interesting, man, because I know a kid that I want to say he's in the 7th grade now, but he out here in the Northwest, he's been rated as one of the best basketball athletes in the Northwest region since he was in the 5th grade. And myself and another coach, we talk about this often, is that why would you be concerned with that? Why are you going to put that kind of a pressure on your child? Because we both know as dad, so we go back and forth. This is a personal thing, when we should be really focusing on long-term athletic development and getting him accustomed to doing some strength training. Now, one thing I can say, he has started some strength training. I have seen him with another coach, but he doesn't train with me and he doesn't train with my friend who knows him and his dad quite well because we come from a disciplinarian background and we come from, we want to be consistent with what we do. Again, I can say he is doing some strength training, but when you focus on winning and being the best right now in 5th, 6th, or 7th grade, I really feel that it's too much pressure on a young athlete to maintain through 12th grade because you're going to get burnt out. It can happen, or you heighten the chances of that.
Yeah, I couldn't agree more. I mean, I think these kids feel the pressure of that. And I mean, there's no question that you want to do well. Even young kids want to succeed. But I think the problem with the pressure from the coaches to really push kids to succeed at all costs at that age is again, what happens if they do fail? What happens if they do get hurt? Are they really tough enough at 8, 9, 10 years old to overcome that? How do they deal with injuries, especially preventable injuries at 10 years old, 11, 12 years old? They don't have the physical therapists every day like the pro athletes. They're in school. They don't have 3-4 hours a day to rehab. I mean, it's a really different animal, and we can't look at pro sports and then use that type of training on our kids. That just doesn't work.
I agree 100%. One of the things as I was thinking about as I was preparing for this interview is that we literally, we train 4 to 5 times a week. Our training sessions run to about 90 minutes, but we'll take anywhere from 30 to 40 minutes with a 6-phase dynamic warm-up. And what I mean by that is we'll do some general jogging, we'll do some crawling as far as like dynamic neuromuscular stabilization, and then we'll get into some soft tissue work. From there, we'll do some mobility work. After that, I might do 1 or 2 static stretching drills based on the needs of the group. From there, we'll get into a dynamic warm-up. And after that, we'll attack the central nervous system before we even get into our workout. And then when I say attack the central nervous systems, we'll do some jumps or we'll do some mini sprint drills. But, after 30 to 40 minutes, my group is warmed up. You're not going to see any knee injuries or anything like that. Some of the things that I do to prevent knee injuries is just basic drop jumps from 6 to 12-inch boxes. We'll do eccentric squats with bands or with our body weight. We even use the K-box with the flywheel. I really love the single leg elevated split squat, the single leg RDL, lateral bounds over micro hurdles, linear bounds over micro hurdles, and just general step-ups to a top-end sprinter's pose on a 6 to 12-inch box. Now, Dr. Geier, what are some of the steps that parents and coaches can take to prevent ACL and other injuries in young athletes?
Well, what you just described, I think, is a good segue to that, because I think, and I hear this from my friends that rehab ACL injuries, these young kids where the coaches are basically just practicing and playing and they're not focusing on strengthening. The mechanics of these athletes is horrible. They don't have any control over their hips and their knees as they land from jumps or they go to turn, so it's no wonder they get hurt. And the good thing about ACL injuries specifically, and these are so common in sports like basketball and soccer and really any sport that involves landing from a jump or turning, especially girls that play these sports, because ACL injuries are so much more common in female athletes than male athletes. There are injury prevention programs, exercise programs that kids can do as part of their warm-ups to significantly drop their risk of ACL tears, somewhere between 40 and 70%. It's not going to prevent every ACL tear, but if you can have a pretty good chance of reducing it, to me it seems like a no-brainer to do it. So there are these programs that are really a series of exercises. They take about 10 minutes, sometimes a little less, sometimes a few minutes more, but they basically are done before practice, before every practice, as many days a week as you really can, instead of doing kind of the traditional warm-ups. And they focus a lot on some of the exercises you just talked about, but it's control of the hip, it's control of the knee, landing with your knee and hip in certain positions, turning with your hip and knee in certain positions, strengthening the hamstrings, which a lot of female athletes are really weak, and you can make a significant difference. If I'm a parent of a female athlete especially, I wouldn't think twice about asking the coaches about them, seeing if there's a physical therapist or athletic trainer from a sports medicine program that can teach them, and making sure my daughter does them every single day.
You know, Dr. Geier, I wanted to ask you, man, in your opinion or in the research journals, and I know you do a lot of reading being a doctor, and I know you're on some, you write for journals. Why is it that there's more ACL injuries in young girls than boys?
There's a lot of theories behind it, and some of them probably play a small role, like the anatomy of the females having more of a knock-kneed appearance and wider pelvis, and a smaller actual ligament compared to males, things like that. There's thought to be hormonal risks. We know that if you put female athletes on oral contraceptives, birth control pills, that lowers their rate of injuries. We don't know why that's true, but there is some sort of hormonal risk. But the big one, we think the biggest risk that female athletes have compared to males is that they tend to have different landing mechanics and turning mechanics. They tend to be more quad dominant anyway, so they land with their knees more extended or hyperextended, and they turn with their knees more extended or hyperextended, whereas boys tend to land with their knees bent, and that's a safer position. That doesn't put a lot of stress on the ACL. But if a girl lands from a jump, lands on her feet, but the knee is hyperextended, that force can pull across the ACL and basically tear it, and she falls to the ground. And again, that gets back, if you can correct some of those mechanics and those muscular firing patterns, you can significantly drop the risk.
You know what? I heard something that you said that's very interesting, and I've only had this conversation with one other sprints coach, and he explained that he's been blamed for sometimes his female athletes getting slower, where they were really fast in middle school, and then once they hit high school, they start to get slower. And then what the other parents or coaches not in the know, they don't understand is that when girls hit puberty, so then things begin to change. They might get slower. And I know we're going to talk about this down the road is, they have to strength train, and then that's when nutrition becomes more important.
Yeah, I mean, I think that there's a lot of things that happen as girls go through puberty, because that's really when the ACL injury risk increases. Before that, they're about the same as boys. They don't develop the muscle strength in the same proportion to their body size and things like that the boys do. And there's probably something to that. So I think that right at puberty, or even a little bit before, or when you start working on these type of movement patterns, the strengthening, that's when you're really going to have your greatest effect. It's not to say that the high school athletes shouldn't do it, but I think if you can really capture these kids and really work on good mechanics, good strengthening exercises, these injury prevention programs at 8, 9, 10 years old, that's where you'll have the biggest difference.
You know what really pains me when I talk to some parents and some youth league coaches is that when it comes to the matter of strength training, they often tend to believe the myth is it going to mess with his bones? Is it going to mess with his joints? And I try to tell them, based on the research done by the National Strength and Conditioning Association, is that those are all myths. And I further the conversation. I tell them that I can train a 6-year-old. We can do strength training if they're willing to listen and that they can follow directions, because they're not going to be hurt by a PVC pipe. They're not going to be hurt manipulating their own body weight, because they do it every day when they run around and jump around at the playground. Does that make sense?
Yeah, I'm a big believer in strength training for kids. I don't think there's any good, credible evidence that says that it hurts kids' growth plates or anything like that. Now, I do think that it has to be done correctly, done safely. I don't think that the goals of strength training for a 10-year-old should be the same as the goals for an 18-year-old. They're not going to get bulky at 10 years old. What you're really doing, working on strengthening at 10 years old, is you're changing how the nerves fire, and you're getting basically more muscle fibers recruited by a nerve firing, which is a good thing going forward. But if you focus on good mechanics, you focus on low weights, maybe higher repetitions, not trying to max out with real heavy weights, making sure they have spotters. I think strength training generally is a good thing. I would in a second recommend it to my kids or to a youth team that I was working with. I generally think if you make it safe, it's a good thing for kids.
I agree with you 100%. And essentially what I explain to parents, we're just really with their body weight or with the PVC pipe, we're just really working on neuromuscular control and movement patterning. Exactly. There's no way that I'm going to put your kid or your child in a position to get hurt, because one thing about me that really puts me in a fantastic position is that I'm in a community of physical therapists, chiropractors, licensed massage therapists, and acupuncturists. And we often meet, but there's a standard that has to be met. In 13 years, I've never injured a kid during training, but I adhere to certain principles that you're going to use your body weight every day. So you're going to walk, you're going to bend over, you're going to squat. We're just doing it more in an academic, or what I would call a structured and controlled setting.
Yeah, I think that's exactly right. I think, body weight is, you can still get a great workout at that age just focusing on body weight strengthening, body weight control. And again, I didn't even mention this. Another upside of strength training at a young age, if you do it correctly, is you might get them interested in it, which is good later in life. That maybe they stick with strength training, resistance training, physical exercise later in life. I don't see that many downsides. Maybe there would be if it wasn't coached correctly. But I think if you do it correctly, what it sounds like you're doing, I have no problem with it.
The only downside that I've seen, Dr. Geier, is that, you have some coaches and some parents, little Johnny needs to get faster, little Susie, we need her jumping higher. And we can't fix them in 4 weeks, 6 weeks, or 8 weeks. This is long-term athletic development. So I try to explain to parents that this is going to, let's see where they are in 6 months. Let's see where they are in 12 months. Let's see if they really enjoy training, because if they don't enjoy training, probably not going to enjoy the sport for much longer. I have a kid that I've been working with from Augsburg College in Minnesota. He had a knee injury last year. I want to say he tore his meniscus, did a lot of PT at the school out there. It's summer right now. Quentin is back in town. So I brought him to the clinic first, referred him to the clinic. He got assessed by the clinic, did about 2 weeks of work in the clinic just to be safe and get cleared for strength training again. For me, at the base of my strength training pyramid is balance and symmetry. So we did a lot for the past 3 weeks. We've done nothing but single limb movements with him. He's taking a short break right now due to his sister graduating. But when he comes back, we'll be focusing more on strength. From there, we go up the pyramid to power. Later, we'll get to plyometrics. And then from there, we'll get into some speed, agility, quickness training. But at the base, I always start with balance and symmetry with single leg movements.
I think that's really interesting, and I think that's great advice. This is funny that we're talking about this. Yesterday, I was on the phone with a guy that I've known off and on through other channels, but he's a physical therapist that works with a lot of athletes, not as much at the pro level, but high school athletes, and then a lot of CrossFit and a lot of adults that are really take this stuff seriously. And he was talking about how common it is for one side to be so much stronger and have so much more control than the other side. And he doesn't understand how people get so asymmetrical or so unbalanced, and he constantly has to work on that, and that's often one of the things he starts on. So I think that's great that you really focus on that early.
We're going to transition right now. What parents should know about concussions in football and other sports. I know this is going to be a touchy topic, but we're going to dive right in with Dr. Geier right now.
Yes.
Yeah, let's discuss what parents should know about concussions in football and other sports.
Yeah, I think that this is one, it's like you say, it's a very sensitive subject, but I think it's something that we need to talk about. Everybody needs to understand the significance. And you can't assume if your son or daughter doesn't play football that you don't have to understand this. Yes, football is the number one sport for concussions, but soccer, especially girls soccer, is right behind. It's common in lacrosse. It's common in basketball. And it can happen in other sports as well. So we need to understand that this is a big deal. We're getting better, no question. What we understand about it is getting better. Coaches are more aware of this now than ever before. Obviously, doctors and athletic trainers are paying attention to this more, but we need sort of more comprehensive education of the athletes, and that a lot of times does get to the parents, because the challenge that we have as physicians or the athletic trainers, maybe at the high schools, is that if we don't see a kid get hit, we don't actually see an injury, and we don't see somebody wobbly around on the field, then we sort of rely on the athlete to tell us something happened. But we've seen it from the pro level. I mean, just over the last few weeks, Tom Brady and Calvin Johnson, there's this talk that they have been hiding concussions during their playing careers. We've heard it a number of NFL athletes, but we hear it at the high school level that maybe up to 50% of high school athletes would hide a concussion in order to stay in a game. And that's very, very dangerous, because if you take another blow to the head before your brain has fully resolved, you can develop very, very serious brain injuries or even death, or even worse, or maybe not as worse than death, but certainly bad. You end up in this chronic cycle, downward spiral of repeated concussions that really, really hurt these kids, not just in sports, but in school and their life. So we've got to take this really, really seriously.
You know what? I think there's a lot of pressure there. And when I reflect on the question in my athletic experience from high school to playing at 2 different colleges, then playing some semi-pro football and then later some indoor football, I know I've suffered at least 3 to 4, maybe even 5 concussions. But there's one particular experience that I remember out in Billings, Montana, playing for this indoor team in one of the first games of the season. You know, the goal is to stay on the team and not get cut and play through a concussion. And I remember early on in this indoor game, you know, I caught a pass, got upfield. I'm a running back, slot receiver. You got to get upfield in arena football, and then you have to get down. But I remember trying to make some moves as if I was playing 11 man, and I get hit by 3 or 4 people. So from the first quarter on, I literally had a concussion, was seeing stars. And it was the pressure of trying to make the team that I played through it. Every time somebody pat me on the head, it felt like I was getting kicked in the head. And it took me about 3 to 4 days to recover, you know. So I can directly relate to that. And I think a lot of guys play through it. When you imagine at the highest level, you know, you have contracts, you have endorsements. So the pressure is just that much more.
Yeah, no question. I mean, I think that there really is a fear. I would argue it's not just the pros, like you say. I think it gets down into youth sports, certainly into high school sports, where these guys really, and girls, they really worry about losing their spot on the team, or at least their starting spot on the team. So they don't want to take that chance. And we've seen good evidence of that in the pros. Alex Smith is the one that comes to mind, the San Francisco 49ers quarterback. When he was there, suffered a concussion, missed a few weeks. You know, his backup, Colin Kaepernick, got the job. Once Alex Smith was healthy, he never got his starting position back. And I think a lot of NFL players saw that and they're like, no, I'm not taking this chance. But at the end of the day, you've got to stay healthy. And this is really a message now for the younger kids. You've got to stay healthy enough that you get back quickly. I mean, why wouldn't you want to take the injury seriously, come out of the game, take, as long as you need to recover. Hopefully that's only going to be a few days or a week. That's certainly better than having a concussion that, basically keeps you out months. I mean, a good friend of mine, his daughter is basically dealing with a concussion now that's going on 2 months, and she's not really able to study at school. I mean, she now is going to class, but she gets headaches in school and all. I mean, it's a really tough thing. And I think that that's why these are so serious. We got to take them very seriously, very early on.
Yes, one of the questions that I had for you, Dr. Geier, was in getting into the fourth quarter, in terms of an athlete going through injury or you doing surgery on an athlete, do you have some type of a test or predictor versus like if the athlete does no rehab, is there a predictor of an injury versus if they do go through a thorough rehab? Does that make sense?
Yeah, I think that it's always injury specific, but I think generally, well, I'll start with this. I think I'm an enormous believer in physical therapy for rehab after injuries. I just don't think anybody, pro athletes, young kids, or any of us adults trying to overcome a serious injury or a surgery can rehab as effectively as a physical therapist can help you do it. I think it's hard for you to push yourself as hard as they can, and you don't have the equipment that they have. I usually use feedback I get from the physical therapist, especially at the later phases. It's more than just getting all your motion back or all your strength back. I think you put somebody through the drills that are basically the same as what you do in that sport. So if it's soccer, you make them basically balance on that injured knee and kick a soccer ball, volley a soccer ball with the other leg while standing on the surgical leg or heading the ball. You make them in tennis, you get them out there and replicate the serving motion and the ground strokes where you're cutting on the baseline side to side. Whatever the sport is, if it's sprinting, can you start from the blocks and push off quickly? You put them through the sport-specific drills that they're going to need to be able to do on the field. If they don't seem like they can do it, there's a side imbalance, or there's a very subtle limp, or it's a little bit of pain with a certain motion, or a very real thing, a fear or an uncertainty of what's going to happen when they try to do it, they're not ready.
Certainly. We're getting into the 2-minute drill, ladies and gentlemen. Dr. Geier, what do you think when you hear these two words, fear and injury?
I think it's very real, and I think it's something we don't talk enough about. I think we're just now starting to get a sense that fear of re-injury is a very real thing. Some of these injuries are very painful, very traumatic, and it's very hard, especially at the young levels where a long time out of the sport, they're away from their friends and all. I think that takes an enormous toll. So I think we as coaches and as parents have to be very, very cognizant of watching for these kids, seeing if something just doesn't seem right, talking to them, and then if you get the sense there is a fear of injury, talk to the doctors, talk to the athletic trainers, and seek help about it.
Favorite leadership quote?
Oh, shoot, you caught me off guard with that one. I'm a huge fan of people like Darren Hardy and Michael Hyatt and Brendan Burchard. I'm not sure I have a quote off the top of my head. Something, here, let me think, something like another one I always like is everything is impossible until someone does it. How's that?
I'll take that. Now this last one here, Dr. Geier. Oh, by the way, I do have Brendan Burchard's book. I think it's the Motivation Manifesto.
Yeah.
Real good piece.
Speak several times. He's awesome. He's actually another guy in the Portland area.
I didn't realize that. I'll have to do some research. Awesome. Now, on this last one, this is for the parent of the student athlete and the coach of the student athlete. If you had one piece of advice to give to a parent or youth sports coach, something they could implement immediately, what would it be?
I would, my suggestion may surprise you. I would say that to make sure that the sports are fun for the kids. If it's a coach, have fun drills as part of the practice. We're not talking about not being competitive, but just make it at least some fun, some laughter, some trying new things, even if it's a little silly. And if it's parents on the drive home from practice, ask about, did you have fun at practice? Did anything funny happen? What did you do? And not put home the, did you win? How did so-and-so do? And, focusing on results, focus on the fun. Make kids enjoy it. They will open up to you if they start having problems, start having pain, but more importantly, they'll enjoy it and hopefully not burn out and drop out of sports.
Ladies and gentlemen, if you're listening to this is 5-star. Let's go to iTunes, Sports Mastery. Dr. Geier is spending his precious time with us. He could be called into surgery at any moment. This is a 5-star show. Dr. Geier, I know you sent me some excellent PDFs, some free downloads that I'm going to link to the show notes. What I want you to do is tell the audience about those downloads, and I know you have a book. I'm going to list all of your information in our show, but let the audience know about the downloads that they're going to get from listening to this show and on the show notes page, and definitely your book, which is on my to-do list.
Yeah, I mean, I've been doing this now online, trying to teach people about ways to stay healthy and perform their best in sports and exercise now for 6 or 7 years. And so I've written articles, and I've got YouTube videos and a podcast that I really love to talk about this in plain English. And so I have a lot of information that Deshaun will share that basically can help you whether or not you have kids that play sports or you just like to play sports and exercise, ways to avoid these injuries. I have tons of information on what to do if you do get hurt and what those injuries mean, but hopefully we can prevent these injuries from occurring. Also, he mentioned real quickly, I have a book called That's Gotta Hurt: The Injuries That Changed Sports Forever. I'm really proud of it. Just came out recently. All of the major bookstores. Talks about 13 of some of the most famous injuries, some you may not remember, but of pro and college athletes, and the unbelievable effects they've had on the sports themselves with equipment and rules changes, or new surgeries or new treatments, or issues that have come from those injuries, be it decisions we're going to have to make about youth sports or issues that we have with adult weekend warriors and controversial treatments. I'm really proud of it. I've gotten a lot of positive feedback. So if you're really interested in that kind of thing, check out That's Gotta Hurt. I think you'll really enjoy that book.
Ladies and gentlemen, you heard it here first with Dr. David Geier. I will link all of his information in the show notes. Parents of student athletes, coaches of student athletes, I have a program that's geared to bridge the gap in communication with the parent and athlete. I have a program that's centered around bridging the gap between the coach and the student athlete. Check out my mastermind group at sportsmastery.com/mastermind. This is a place where the parent and athlete participate together. This is a place where the coach and the athlete participate together. You've heard it here first with Dr. David Geier.